Hello, today I'm here to talk to you about my pre-doctoral fellowship 1 year through. I'm going to talk to you about where it started, how it's going, and where I see my remaining year going as well. So where it started, back in 2019, I completed an ARC fellowship, or as it was known back then, a Clark fellowship. This ignited my renewed love for research. The past few years, I've been working in community nutrition and I've enjoyed working with patients and still do this role alongside my pre-doctoral fellowship. During my ARC, I discovered many new research interests and I didn't feel ready to commit to a doctoral fellowship. I found the pre-doctoral position and knew it was perfect for me to explore some of my new research interests and further develop my skills. So how is it going? I started back on March 18th, 2020. The first few months were definitely a learning experience, and I made some virtual connections and worked with new colleagues. I luckily was able to meet a few colleagues in the department back in February 2020 in the primary care and public health department. I had the opportunity to learn about some of the projects already happening. And once I started in March, I was able to reach out to some of these people and express interest in the projects I was interested in working in. I started working on a project which was designed by Imperial and the Royal Borough of Kensington and Westminster. It was to support children in one of the most deprived wards in the UK, the Golborne ward. I started supporting on the project in May 2020, and my role initially was to look into some of the lifestyle data that was collected for the project. I thought the research project would typically work along these lines. I'd start working on it and get amazing results, disseminate my findings, and write papers. But in reality, it's looked very different. When I started working on the project, I was excited to be joining a new team and a new project that I was really passionate about. But within a couple of weeks, the postdoc I was working alongside found another role. This meant a lot of responsibility fell into my lap. There were some issues with complications around ethics and approval of data. I then had to learn Stata and spend months cleaning the data that I was going to be working with. I've gained some valuable skills around learning what an open cohort is and took on some more responsibility with the BMI data as well, but it's still ongoing. I've learned so much and I'm really excited to be working on a project that can better support local authorities with their spending. I've had great support from my supervisors, line manager, and others in the department. What's to come? I hope some more amazing results, and I want to disseminate my results to the council and gain experience writing papers and sharing my work at conferences. Thank you very much for listening.